Alright guys, welcome to episode 177. Today is on ADHD and the Neurobiology of the Stimulants, part 1. Alright, ADHD is associated with dysregulation of dopamine and norepinephrine signaling in the brain regions responsible for executive control. The key brain regions affected are prefrontal cortex for planning, attention, and impulse control, the basal ganglia, which is for motor control and behavioral deregulation, and anterior cingulate cortex, which is for error monitoring and decision making. Now, neurotransmitter abnormalities is commonly associated with reduced signaling of dopamine and norepinephrine. Low activities in this pathway leads to attention regulation, difficulty in sustaining focus, your working memory, reduced task retention, impulse control, increased impulsivity, as well as motivation, reduced reward sensitivity. So, how does stimulants correct this? Stimulants such as Adderall or Ritalin or methylphenidate increase the dopamine and norepinephrine levels in the prefrontal cortex, which improves the signal-to-noise ratio in neural firing, the executive function, sustained attention, as well as behavioral inhibition. Neuroimaging studies show that normalization of frontal cortical circuit activity after the stimulant treatment has been successful. The comparison of major ADHD stimulant medications, the two key pharmacology differences are the way that your body synthesizes amphetamine or methylphenidate. So amphetamine is Adderall, amphetamine salts, Vyvanse, which is a prodrug. It only synthesizes once it's in your body. Increases neurotransmitter release. The methylphenidate mainly blocks the reuptake transporter, which is medication that I've been on since I was about 18 years old. So they work differently, and sometimes matching two together can work a little better than just having one. I am trying out maybe the Adderall or whatever. Might help me sustain the XR throughout the whole day while taking the methylphenidate immediate release, blocks the reuptake transporters, as well as using the amphetamine salts to increase neurotransmitter release. Now, I don't know if that's going to work better or not, so I have to talk to my doctor. Anyways, clinical considerations. Physicians may choose among these medications based on the symptom profile, the duration of required coverage, such as your school or your workday hours, side effects, your tolerance to the medication, risk of misuse of the medication, as well as coexisting conditions, such as anxiety and sleep disorder that might take effect. Alright, so lastly, the futures of Adderall and Vyvanse and Ritalin are all different. So the active drug for Adderall is mixed amphetamine salts. It releases dopamine and norepinephrine. The onset is about 30 to 60 minutes. Duration, it lasts for 4 to 12 hours depending if you're on the immediate release or the extended release. The abuse potential is moderate to high. It really depends, you know what I mean? People is going to abuse it, doesn't matter what it is. So, either you don't abuse it or you take it properly, take it, as your doctor prescribed, or make sure your doctor knows what you're taking. And, that's the whole point of having a doctor. So, alright, so Vyvanse is a prodrug of amphetamine. It converts dextroamphetamine after the absorption into your body. So the abusive pattern is usually much lower, and that is why the prodrug came out. The onset is about 1 to 2 hours, and it lasts about 10 to 14 hours. Lastly, the most famous Ritalin, I hate that word, is the methylphenidate. It blocks the dopamine instead of conversion or release of the dopamine. It blocks dopamine reuptake. Onset 20 to 40 minutes, and it lasts 3 to 8 hours depending on the formulation. The abuse potential is low to high. So the comparison of ADHD medication, as I've already said, it's pretty interesting, and there's more information in the description. So go ahead and take a look at it, and let me know if there's anything I can explain. Thank you.